Bird flu cases are surging nationwide, and despite its low risk to humans, local health officials are on alert for potential mutations that could put humans at risk.
The country's first H5N1 bird flu death in a human happened just this month on January 6 in Louisiana. The death came amid the culling of millions of chickens across the country and recalls of pet foods like Northwest Naturals frozen cat food that killed a house cat in Oregon last month. Lane County Public Health tells us the first reports of the virus in humans surfaced back in 1997. But to date, H5N1 hasn't found a way to spread quickly from human to human. That isn't stopping public health from keeping a close watch because of the virus's tendency to mutate rapidly.
This seems to be a virus that's looking to extend its range. I think that's clear. It started out in wild birds, and all of a sudden last year we saw it in dairy cows, and now we've seen it in cats.
In Lane County, there have been no human cases reported so far, with just one confirmed case in the state. Lutke says the unpredictable nature of the virus has made having an influenza response plan a nationwide requirement.
We are concerned that it could gain some mutations that allow it to spread rapidly from human to human. We are especially worried about infections, for example, in pigs, because they can be infected by the avian viruses and by human viruses.
If pigs get co-infected, Lutke tells us it could produce a unique virus that could cause severe disease in humans. So far, only a single pig in Crook County has been infected in Oregon. According to the CDC, 3 human cases of the H5N1 virus were reported in dairy farm workers in April and May of last year. Workers at the Cascades Raptor Center say there's a trend they're seeing that could put residents at risk.
People out in the public, as they've been coming across sick birds, and then they've been taking them to their home, putting them in their car. It's definitely not what people want to do.
Lacey urges residents to look out for symptoms and stay away from sick birds.
They will be having what we call kind of like a typewriter head, where they're moving it back and forth kind of uncontrollably, or waterfowl like ducks swimming in circles.
Birds also stagger and sometimes become unable to fly or walk. In humans, Lutke says look out for common cold symptoms and conjunctivitis. Those who've interacted with waterfowl, shorebirds, or wading birds should be tested and treated quickly.
We have 4 different antivirals that work against this H5 influenza virus, which is a good thing. So if we all of a sudden did have lots of cases, we're better prepared. We also have stockpiles of H5 vaccine.
If you see a sick bird, Lacey says to call the Oregon Department of Fish and Wildlife because there's usually little that can be done once some birds are sick.
Certain bird species, if they get this version of influenza, they are almost always going to die.
She also warns that birds can often be asymptomatic.
Lacey tells us because the virus is so contagious, any sick or hurt birds brought to the Raptor Center are put in isolation from their ambassador birds and other birds in their bird hospital.